fatigue, weight gain, irritability, digestive problems, potency issues. Can you maybe imagine that this could have something to do with a blood pressure medication? And the connections and why it could also be the case for you, I'll explain to you now in this video. I'm Dr. Petra Bracht, a physician specializing in general medicine, naturopathy, and nutrition. I'm well aware that this is a very provocative topic, but I chose it for a good reason. About a year ago, I made a video about which medications can cause weight gain. And since then, more and more people have been talking to me about it because they've noticed exactly what I described in that video happening to themselves. And this is especially about beta blockers, which are prescribed very frequently. Not only for high blood pressure, but also for heart palpitations, arrhythmias, or even heart failure. Let's assume you have slightly elevated blood pressure. Then you add a little bit of extra weight, maybe 4, 5, or 6 kilos, but otherwise you feel pretty good. Your doctor, who treats you according to the conventional gold standard, meaning the best available therapy, will usually prescribe you a beta blocker for your blood pressure at that point. Most of the time, both you and your doctor are quite satisfied with this approach at first, because you know that high blood pressure is dangerous, there's a risk of stroke, and so on. At least that's what you believe at first glance, right? Because beta blockers lower your heart rate, meaning the number of times your heart beats, by blocking the effects of the stress hormones adrenaline and noradrenaline. This means the heart muscle needs less oxygen and is relieved. If only it were that simple. Thanks for staying until the end. Because maybe a year later, maybe 3/4 of a year later, or a year and a half later, I have no idea. Will the situation look a little different then? Thank you very much. You've usually gained a few more kilos, and by now it's quite obvious to see. Curiously, your blood pressure has also continued to rise, or at least hasn't gone down any further, so the dosage usually must be increased. And your mood has also gotten worse because you're just dissatisfied, you're somehow constantly tired, and you can't really explain where it's coming from. Because a year ago, you didn't even know anything like this. Your creativity has also fallen by the wayside, and your potency may have noticeably decreased as well. But why actually? What is unfortunately often not mentioned when prescribing beta blockers is that this medication, this beta blocker, also slows down the metabolism as a whole, and therefore the entire energy metabolism as well. That means after all the side effects I've already mentioned above, your fat burning also decreases even further. And that's with the same lifestyle. More and more fat accumulates and you gain weight. The daily frustration that your clothes no longer fit and comments from those around you, of course, don't lead to a better mood. And on top of that, you don't have the energy for exercise anymore because you just don't feel like it. And you can't find a solution for your declining potency either. By the way, these potency problems caused by blood pressure medication are a huge issue. Attention, because potency problems in general are the first serious symptoms of vascular diseases. Of course, high blood pressure is also a vascular disease, which can also affect the heart, the kidneys, and the brain. Here, it's not just a potency drug that helps, but definitely only a change in eating habits combined with exercise. It's absolutely worth trying. Blood vessel walls that are already damaged can heal again through diet and exercise. All of the things I just mentioned happen when you take beta blockers, which are often considered harmless. Wouldn't it have been great if you had known beforehand that every kilo less lowers your blood pressure by 4 millimeters of mercury? That would be 20 millimeters of mercury for 5 kilos less. And there really is a difference whether your blood pressure is 150 over 100 or, after losing 5 kilos, 130 over 80. And with that, it's very likely that your blood pressure would be back in the normal range and you wouldn't need any blood pressure medication at all, not even a beta blocker. And if in addition to that you had eaten more consciously and done half an hour of moderate endurance training 3 to 4 times a week. Then, with a high or even the highest probability, high blood pressure would soon be a thing of the past. And why? Because all those negative, significant things like me, my weight gain, and so on would have been avoided as side effects. You would be in a better mood, your potency would be back to its usual level, and you would just feel comfortable again. In your body, in your skin, everywhere you can feel something. Just like that. The solution is actually quite simple. Take action yourself. Maybe you should look for a doctor who can explain to you what steps to take and help you make a plan. Otherwise, there are now really many good YouTube channels or great books that show you exactly how it works. Here in this new book of mine, Gesund mache in der Wahl Fasten, you'll find everything you need so that you don't have to let your high blood pressure stress you out anymore. There are so many people who have high blood pressure. Please share this video and, of course, write comments below. I always find that very important. It's just nice to read what you have to say about it. And otherwise, give it a thumbs up. Thank you, thank you, thank you. And if you want to see more of my videos, you can do that here. And otherwise, I just wish you to stay healthy until next time. See you then, yours, Dr. Petra Bracht.